Welcome back to Rare Connection, the podcast that gives voice to the often unheard stories in the rare disease world. I'm your host, Joanna. Today we're focusing on something that affects nearly everyone in the rare disease community, but is still too often left in the shadows: mental health. Living with a rare disease isn't just physically exhausting, it's emotionally overwhelming. In fact, research shows that around 75% of rare disease patients experience anxiety, and more than two-thirds report symptoms of depression. Many feel isolated, misunderstood, or even dismissed by the medical system. My guest today is Frank, a rare disease patient who's living with sarcoidosis and other chronic conditions. Frank knows firsthand the emotional toll rare disease, and he's using the experience to drive change. He recently moderated a panel at the World Orphan Drug Congress USA, focused on mental health in the rare disease space. And now he's working to make affordable mental health care professionals accessible to people like you and me. Before I get started, if you were, this podcast is for informational purposes only. If you please seek medical advice before using anything that is mentioned in this podcast. Whether you are a patient, caregiver, clinician, or simply someone who cares, this conversation is for you. Okay, a lot of these questions stem from comments that I got in questionnaires that I posted in the book. In the Facebook groups. First, let's talk about what it really means to support mental health in the rare disease community. You lived with sarcoidosis and rare conditions. From your perspective, what are the biggest mental health challenges patients face, not just physically but emotionally?
Well, thank you. First of all, thank you for having me here. I've been living with sarcoidosis since 2011, but really I was misdiagnosed in 2004. So I'm trying to get the word out there, not just about rare diseases, but also how mental health affects rare diseases. I personally have dealt with it since 2011. It has changed the rare disease changed my life much more than just the physical aspect of it. It changed my mental health aspect. I went from being a runner and being able to do, run 5 to 10 miles a day, to all of a sudden I couldn't even walk a quarter of a mile. Without running out of breath. So it was very rough on me mentally, having to give up so many different things for this disease. So, one of the big things about mental health that people don't realize is one of my main phrases that I always tell everybody is physical health and mental health equal total health. You can't have total health without the other. So one of my doctors actually he told me he's going to exaggerate this, but he told me this one of the very first times I met him. He said fighting your rare disease is going to be 90% mental and 10% physical. He goes, I know I'm exaggerating a little bit. He goes, but here's why I say it's 90%. He's telling me is that. He goes, I could give you any medicine to fight this disease, but if you give up, it doesn't matter. it doesn't matter what I get.
Mm.
So he was like, so you have to put into your mind that you want to fight, and that you don't want this disease to define you. You define the disease.
Mm-hmm. So, one comment already. React with love. Yes, I am fine. So, thank you for asking. One person said that a week leading up to their regular MRIs is filled with anxiety. They lived in fear and of another bleed, and have to wait in limbo until the results come in. Does that resonate with you and others you have talked to?
Oh yes, it's always that hurry up to wait is what I always call it. And yeah, I find that for me in particular is that the fear of the unknown actually makes me more anxious than if I know what I like. I've been, like you said, I have multiple diagnoses, and I always tell my doctor I'd rather know about the diagnosis, because the fear of the unknown is the part that always gets me and always gets me anxious. And so yeah, I definitely totally understand that. One of the big things that I've learned to do is, and it's easier said than done, it took me a long time to get through this, is really breathing techniques. Mm-hmm. Using breathing techniques, because everybody says don't worry about it until you get the results. That's never gonna. I wish it was just that easy, but yeah. So I do try to do breathing techniques. I try to think of other things to do, get my mind off of it any way possible. Even just little things. For me, it's playing with my dogs. I have 2 dogs, and they help me so much when it comes to my mental health. Just having them there, and because they're always there, and they're always happy, and they're always wanting to play, and they're always so they get to keep my mind off of a lot of things because of that.
Yeah, studies have shown that animals do really help with even petting an animal can really help.
Yes.
How does chronic uncertainty affect a parent? How does chronic uncertainty affect a parent shared I'm just going to start with that. How does chronic uncertainty affect a? I guess it does. Affect a parent shared how it is when your child is nonverbal and doesn't know and if they are in pain or distress.
Yeah, that's one of the hardest, unfortunately, that's one of the hardest things too, because the child can express how they are feeling. Unfortunately, you learn as you go, by their cues. A lot of children, people who aren't verbal, anybody, whether it's child or an adult, they will have certain cues that you will start to get used to, and you'll notice that when they aren't feeling well, or if they're uncomfortable, or if they want to try to tell you something, and you could see that they're getting frustrated. It's really tuning into the person, the child, the adult, or whoever is nonverbal, or because even myself, like, I could speak well, I'm fine, but there's days where my wife knows before I do that I'm not feeling. It's because she knows my cues now. She's in tune with my cues of, she's like, all right, you're laying down a little too long today. What's going on? Or, so it just really, you have to get into the finding what their cues are. Like, even when they're comfortable, learning those cues as well. Because knowing that they're comfortable will make you feel better as well. So it's just really trying to get in tune with those cues.
Mm-hmm. How do you think mental health support could be better tailored to caregivers in the rare disease space?
Okay, yeah. Caregivers are a special breed. I always say that. They always put everybody else in front of themselves, especially the other patients, because of the physical. They see the physical. You don't see, per se, the mental aspects. So one of the main things that I always tell this to all caregivers, tell this to my wife as much as possible as well, is you need time for yourself. It's okay. It's okay for you to say, I need to step away. It's okay. You can't be expected to do everything at all times, at every time. Because, like, for me, I'm on disability now. So my wife is the worker in the house. So she works. Then she comes home, and then she has to take care of me. And then, and it's like, when do you get time for yourself? So you have to, so I always tell her, you make time for yourself. And I'll walk away and tell her, all right, this is your time. You want to watch TV? Decide what you want to watch. It's all on you. Or, if you need a bubble bath, just to get away. You need time to get away. Go. It's okay. I'll be all right. I know how to take care of myself a lot of the times as well. But you need to ask for help. Don't be afraid to ask for help. Ask whether it's other family members or friends, or you can't do this all yourself. Nobody's Superman, Superwoman. I wish there were more of us that were Superman, Superwoman, but we're not. But I just feel, you have to be able to say, whoa, time out. I need time. I need help. Mm-hmm. I always say it doesn't make you weak to ask for help. It makes you strong when you ask for help. When you realize that you need help, that's what makes you strong.
Mm-hmm. Yeah, I have seen this a lot. I work. I'm not only a rare disease patient, but I also work as a caregiver. And that is one thing I do see is that the family members a lot of times will be the only person that the person allows to care for them. And so that's putting a toll on their emotional health and we're not the more physical health than anything else, because it has caused heart problems before.
Yeah. Kind of have to condition the patient to be able to trust other people, because, like I said, you're not gonna be around all the time, and you're not gonna be the person as much as they want you. Like I would love to have my wife taking care of me all the time, but she's not able to. So you have to be able to have the patient comfortable with somebody else around.
So one phrase that really struck me came from someone who described having a medically induced complex ongoing traumatic stress response, basically trauma, from being dismissed, lied to, or gaslighted by medical professionals. How common is this and what kind of how common is this? Yes.
Oh, it's very common, unfortunately. It's a lot of doctors will there's some doctors that it's my way or the highway. There's also other doctors that be like, like you said, the gaslighting in the fact of, you got to do it this way. You got to, things got to be this way, otherwise it won't get better. They forget that doctors need to treat the patient, not the disease. And I always tell anybody that I advocate for or with, I always tell them, first of all, you have to be your own best advocate. You have to learn about your disease as much as you can, or whether it be you or the caregiver, whoever can speak for that patient has to learn about the disease, because otherwise you will get doctors that will. I mean, I could go back to in 2014. I was kind of new with my disease. I was still 3 years into it, and I was listening to a rheumatologist, and at that stage, I was just kind of listening to him instead of asking questions. And they gave me a medication, and I upset my stomach. It gave me a hole in my colon, and it could have been avoided because everybody knew I already had problems with my colon. All I had to do was look at it, but they didn't look, and I didn't say anything to top everything else off. Well, because of this, I ended up with sepsis in my body, and I almost passed away. I was in a surgery for almost 8 hours due to this one mistake. And so, yeah, I learned. Unfortunately, you learn the hard way, But yeah, so you have to be your own best advocate. You have to be able to speak up. If it's not for yourself, it's somebody else speaking up for you. And don't be afraid to say no. You're allowed to say no. And the other thing is, I've been through many different doctors. If I don't feel comfortable with a doctor, I'm not staying with them. I mean, it's my life. This is my, unfortunately, this is my disease that I am dealing with. The doctor gets to go home, and, well, I get to go home, but I go home sick. So, you have to be able to feel comfortable, because having that comfortable feeling also affects your mental health, but also affects your total health.
So someone living with VEDS, VEDS, said that after being diagnosed, they had to reframe. They had to reframe the entire life, learning to live in the present instead of fearing what would happen. As someone with multiple serious conditions, how do you balance fear and hope?
It comes down to I live for the moment. I used to make all these big plans of things that I'm going to do in the future and all that. And what I do is I set different types of goals. Like, I'll have my short-term goals, and I celebrate every goal. Like, once I reach every goal, I celebrate it. Because it could be something really, really small. It doesn't matter. Because that'll help your mental health. That'll help your positivity level. But and one of the things I always tell myself is that if I don't reach my long-term goal or even my short-term goals, it's not the end of the world. You set another goal and you try to reach that one. And then, you just keep on, it's that putting that one foot in front of the other, effect. And you really want to make sure that you don't weigh in on all the negativity, because you're going to have the negativity anyway. I mean, the disease itself is going to bring negativity to your body, to your body and your mind. So, what I try to do is keep out all that extra negativity that doesn't need to be there. And I don't need to worry. Like I said, if I don't reach a goal, I don't wallow in it. I'm like, all right, so I didn't reach it. So what can I do next time to try to reach this goal? So I automatically go right to something else instead of wallowing into what I didn't do. Because when you do that, your brain, like I said, your brain is so strong. And when you're thinking negative thoughts, it affects your whole body.
Mm-hmm. So what kind of damage does it do over time?
It doesn't really even matter what kind of disease you have. If stress can kill. Unfortunately, it really can. It can hurt your immune systems. It can bring down your immune systems. It can. It also, like I said, it'll affect your the way you're thinking. If you start thinking negative, you're not really fighting your diseases like you're supposed to be doing. You're going to start, getting into that. Oh no, I got a cough. Oh no, here comes a cough. What's going to come next? You're always waiting for the next hammer to fall. And that's something that I've learned the hard way as well. Is when I started to think about what's the next hammer that's going to fall, I found out, you know what? That hammer does fall. Mm-hmm. Because I'm thinking it's going to fall. I'm making it fall. It's not, I'm helping it. Now, I'm not saying I'm the only cause that made this hammer fall or whatever, this next part of me getting sick. But when I start wallowing in and I start thinking about it, and I feel my body getting weaker and weaker and weaker. And so instead of thinking about what's going to make me weaker, I'm thinking about, all right, what can I do to make me stronger today? Like I was talking about earlier about walking. Yeah, I could. When I first got sick, I went out for a run and I only made it a quarter of a mile. Well, now I don't run, but if I've gotten to the point where I can walk and I can walk for a mile, yeah, I get tired, but at least I could get there now. I couldn't do that. Or do it, that infamous 6-minute walk, that all people, who have, especially with lung problems, that's a dreaded test. But if I don't make it to 6 minutes for the test walk, I'm happy that I made it 4 minutes. I'm happy I made it even 2 minutes. Hey, or I look at it as, did I do better than last time?
Mm-hmm. So you moderated a panel on mental health at the World Orphan Drug Conference, and you now work on getting affordable mental health care into the rare disease community. What are the barriers right now, and what kind of progress are you hoping to make?
The two major barriers. First off, and this one's hard for me to fix right now, but the biggest problem is there's not enough people, not enough psychologists, there's not enough counselors, therapists. So unfortunately, there's just not enough mental health professionals for the demand. So that's something that I'm trying to figure out how I'm going to help. But the second problem is just a lack of knowledge. It's different for a person that deals with depression and anxiety that doesn't have a rare disease. So, like, being a counselor, one of the biggest things, like, I have the same counselor since 2011. And one of the biggest things that we found was learning about the disease together. I am so lucky to have a counselor that wanted to know about the disease just as much as I did. Mm-hmm. So this way she could help me. So one of the things that I've been doing is working with counselors by getting them information on the rare diseases that they're working with, their patients. So there's an online therapy, onlinetherapy.com actually, that gives a percentage off on the copay for sarcoidosis patients right now that I work to deal out with them, and they get 20% off, which it doesn't sound like much, but it helps. Everything helps at this point. But one of the things that I promised the counselors that gave this 20% off is that I will give them the information on the disease before they even meet the patient. Mm-hmm. So this way, the counselor's already one step ahead. I mean, who has months for the counselor to read up on, like, my disease, sarcoidosis? It takes months and months and months to read up on my disease. If I can give you information on the disease before you even meet the patient, and then you can work together, mm-hmm. and it makes, like, for me, I know it made me feel like I was wanted by my counselor, first off. Second off, it felt like we were working together. Mm-hmm. It wasn't like we were working against each other or like, I didn't have to explain as much. So I could actually talk about how I was feeling and how and why I was feeling these ways. Because whether it's the pain or a side effect of the medications or something like that, they would understand it better. And we could really talk about it. And instead of it being a superficial conversation, it actually becomes an in-depth conversation. There are conversations I talk to my counselor once a week for an hour, at least an hour a week. And we could talk about one thing for that whole hour. But I felt like I got something accomplished. Mm-hmm. Yeah, so that's one of the things. And I'm working on trying to get some more counselors to join in and more groups to join in. But like I said, we're dealing with just patients alone, 30 million patients in the United States that have rare diseases. And then to talk, the way that I have it set up for the sarcoidosis patients right now is it's not just for the patients. It's for the caregivers. It's for the family members. And that's like the sisters, the brothers, so they can have somebody to talk to as well. Mm-hmm. Because it's hard to understand a disease, especially a rare disease, and if you've never heard of it, so you don't know what it's supposed to be, what the side effects are, what it's going to do to the person's body. Or, like, I always tell my family members that I can't make plans saying, yes, I'll be at so-and-so gathering, and I won't know until I wake up that day. So, so I'm trying to make sure that it's the whole community, that it helps the whole community, not just the patient, because the rare disease affects the whole community. It doesn't just affect the patient.
Mm-hmm. So, so do you have any kind of resources that you're using?
Well, it's nice to have resources like groups like Global Genes and, the umbrella groups, I could always call them up and ask for information. Or for my own disease, there's a national organization called Foundation for Sarcoidosis Research that really can help out with any of the information about the disease itself to help. So I can, I could always reach out to them and ask them if I needed some sort of information. The national organization, one good thing that they have for sarcoidosis is that on their website, they break it down by different parts of the body. So I could just print it up right from there, and I could just give it to them. And then I have no problem talking it out with the counselor until they feel comfortable as well. So and then there's I really try to look into just other mental health, like NAMI. I talked to that NAMI, which is National North American Mental, and then Mental Health America. I talk with them as well to get information on how I could explain it better. Mm-hmm. Because I want to make sure that the counselors feel comfortable. Because I know it's hard enough for me to understand the disease. Trying to explain it to a counselor who has 50 to 60 different patients. And trying to get them to understand it as well. So I reach out to a lot of different organizations and just try to. I'm still working on trying to make not a playbook, but like more of a comprehensive, I guess a book, so people would understand it, like a workbook of how, of where you can go look for stuff. What questions. I'm working with psychologists right now, and we're actually going to send out a survey coming out probably in the next month or two, asking patients their opinion on mental health. Like how does it affect them? So how can I make it easier to explain it to a counselor from a patient's perspective, or from a caregiver's perspective, or from a family member's perspective? So we're going to come out with a survey asking out questions from patients, and hopefully, we'll get patients, caregivers, the whole community to answer the survey, so I can start working onto our next spot and trying to, education.
Mm-hmm. Do you ever connect with National Organization for Rare Diseases or Every Life?
Yes. Yeah, I'm actually I'm on the RDAC for New York for NORD. I work with Every Life. I've been working with Every Life ever since I became an advocate, so 13, 14 years ago. So I've been working with them, and like I said, at Global Gene, same thing. I've been working with them, so everybody's been everybody really wants to help, and we're just trying to figure out how to really get this going forward. Because I'm the type of person where I know everybody likes to point out like this isn't being done, this isn't being done. My first question always is, what are you doing about it? How can we fix it? Instead of just pointing out problems, how are we going to fix the problem? So that's where I'm at now. We pretty much know what the problems are when it comes to mental health. Mm-hmm. It's just now, how are we going to get to that next level of the education? That has to be our next course of action, is educating. And then how are we going to get it out to the masses? How are we going to get it out to the counselors? How are we going to get it out to the psychologists? How are we going to get it out to the patients, the caregivers? Because it has to be everybody involved. It can't be just one here or there.
Mm-hmm. So how do you go about getting these discounts?
Phone calls. I just called up. I looked up online on these, especially, I started doing it a lot more when it was actually just before COVID even hit is when I started doing this. Calling up online support groups, because there's so many people that can't get to counselors, physically get to counselors. So having online counselors is, it's definitely needed. So I started calling them up, and I talked to presidents of different different online support. Like I said, onlinetherapy.com. I've talked to Better Health and Help, Calm. I've talked to, and just trying to see, how can they help us and how we can help them, because we're getting them patients as well. So, we're going to bring money because they are charging. It's just part of life. It's not like we're going to get it free, but if we can help each other, I think that it would help. It would make things go so much smoother, and I think more people would want to join. More counselors would really look at it and go, "Oh, wait a minute! Look at this! I could get all the information.
Yeah,
we have the resources to get all this information." That's something that a lot of counselors, I've talked to counselors, and that's one of the biggest things they talk about is not having the resources. Mm-hmm. And so if we can get that resources and break that barrier for them, it makes it so much easier, their job easier.
Yeah. I have been trying to get this podcast into a university, but it covers all rare conditions, and so most doctors want to stick to their own specialty, and it's makes it harder, even though doctors do have to cover the whole body.
Yes, exactly. Yeah, one of the things I've started is we have a university hospital here, Stony Brook University, and it's a hospital as well. I've actually spoke to their medical students, and I've also spoke to their. They also have psychology students as well. So mm-hmm. I got to speak. Go to their classes and speak to their classes. So I actually get their ear even before they become doctors, or So it's nice to make them think. Two people that I worked with at through Global Genes, how they pair up a patient with a medical student. They have this program, and two of the students that I dealt with are now both of them are two of them are doctors now, and they work on internal medicine and with focuses on rare diseases. So I still talk to them. Yeah. So it's nice when you can get to talk to them early enough and get in their ear, because they're they get influenced that way, and so hopefully, it's always a work in progress. I really believe this education piece that we're working on will really make it. I think it'll make it easier for not just the counselors, but also make it easier for our community to be heard. So that's why I really am gonna really push this when we do the survey, because it's gonna help you just as much as it's gonna help the counselors.
Mm-hmm. So if someone is listening, is feeling overwhelmed or unseen, whether they're a patient or a caregiver, what would you want them to know?
Well, you can go on to my website, and there's a whole page on my website that is just dedicated to mental health. Mm-hmm. It's all different links, whether it's for vets, it's for patients, it's for caregivers, it's for there's all different links. Don't be afraid to ask for help. Mm-hmm. I always tell everybody, it's always been my mantra, you are not alone. Mm-hmm. And you don't have to be alone. Yes, this is a lonely, rare diseases are lonely, but it doesn't mean that you have to be alone. So I always make sure that they can go on. My page is really easy to remember. It's SARC, SARC ofli.org.
Mm-hmm.
That's it. And they go on there, and all you have to do is hit it says mental health on it, and it has all different links up. As anything I try to fit in, and if you know of any links, please let me know. I will put it on.
Mm-hmm.
I tried to fit in every little link that I could think of, just to ask for help. It's okay. This is a personal story of mine. In 2015, I actually had to put myself in a 72-hour watch, which means I put myself in a hospital because I came close to committing suicide. Mm-hmm. I had it all planned out. I was ready to do it. And my counselor actually talked me out of it. And so I've been there. I know how hard it is. I know how rough, our diseases are painful. It's lonely at times. But it's okay to ask for help. I'm glad I did. It has changed my life. And a lot of people, when they first hear about me actually putting myself in a 72-hour watch, they're like, but you're strong. It doesn't matter. Mm-hmm. It doesn't matter. Anybody can need help. And like I said, I was strong because I asked for help. Mm-hmm. If I would have been weak if I didn't. So, there's always links out there. If you don't know, you can always contact me and I will find out. If I don't have it or don't know it yet, I will find out for you. Mm-hmm. I have a lot of contacts, whether it be counselors, whether it be all different types of people, from pharmaceuticals, from clinicians, researchers, doctors, all different types. I've worked with a lot of different people, so I do have a lot of contacts. So if I don't know, I will find out.
Mm-hmm. So, how can others support the effort to make mental health care more accessible in rare disease?
Speak about it. I really believe we need to speak about it. We need to get it out there. When, we talk about World Orphan Drug Congress. I just was talking to the lady who sets up the speakers, and I was like, 3 years ago, we only had a round table. That's how we spoke about mental health in this round table. There's 1,000 of people at this event, but only 11 people could fit at this round table. And that's how it was 3 years ago. Then 2 years ago, they actually asked me to go up and actually speak for 20 minutes. So I got to speak about it for 20 minutes. And then this year, we got a panel now. And I was kidding around with the lady. I'm like, next time we want a keynote speaker. We want the keynote spot. But it just, we need to make it where people feel comfortable about speaking about mental health. Mm-hmm. It's not taboo. It's, like I said, it's okay not to feel okay. Mm-hmm. So I think that's the biggest thing I could tell people is don't be afraid to speak about it, and don't be afraid to ask for help. Only you can ask for help. We can't make you. So you have to get to that point. If you really want to fight for yourself, you need to fight both physically and mentally. So I always tell people, and then like I said, when we have these surveys coming out, and it's not just me that are doing these surveys, for Sarcoidosis, the national organization, they did a mental health survey that, and I'm sure they're going to do more. They're going to expand on it. And there's other organizations that are it's starting to become more, what's the best word for that? More in tune. Everybody's starting to speak about it. And don't be afraid to speak about it, and don't be afraid to listen.
Mm-hmm. Yeah, that is one thing that one of my teachers did tell me is if you don't ask, you won't get.
Yes.
And very true. I've actually recently ran into not a rare disease patient, but there was a woman who said she didn't feel comfortable around somebody at a bus stop, and I said, if you would have said something, we might have been able to do something, but since you didn't say anything, I didn't know.
Yeah, exactly. Yeah. We went to, in the sarcoidosis community from 2015 to 2017, I personally knew of 30 people who passed away in our community. And out of those 30, 18 of them committed suicide.
Oh.
That was my big eye-opening moment of my life, where I was like, this can't happen. It can't be happening. And out of those 18, 12 of them were men.
Mm-hmm.
And that, the stigma, we need to kick those stigmas out of there. The whole men are strong, they don't need to ask for help, blah, 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 blah. That's what I always, always like. But it's those people, they just didn't know how to ask or who to ask. And, us as organizations, and I think organizations really have to take the ball and really start helping and trying to get the word out there and trying to figure out what's going to help our patients. Mm-hmm. And we do that on the physical aspect. All the organizations do, so much work on the physical. But you got to work on the mental. You have to.
Mm-hmm. So, Frank, thank you for thank you for sharing your story, and for helping lead a movement that puts emotional health in front and center in rare disease care. Your work is making a difference. To those listening, I hope today's episode reminds you that you are not alone. Mental health challenges are real, valid, and incredibly common in the rare disease community. If you're struggling, please reach out for help. Help exists, and you deserve it. You can follow Rare Connection on Facebook, X, LinkedIn, and if you're watching this on YouTube, you can comment. Please subscribe to my channel, Rare Chef, and leave a comment below. If you're listening on the audio version, check the show notes for a link to send me a text. I'd love to hear from you. And going back up, those numbers for the suicide hotline are 988, and you can also text 741-741, hello to 741-741. And as always, we close with this. If you or someone you love is in emotional distress or facing emotional mental health, please call. Like I said, text 988. You can also call it's called or text. And in the U.S., you are never alone. Anywhere, you're not alone. Not just in the U.S.